Good morning, everyone. We're going to give just a few more minutes or another minute for everyone to join and we'll get started. Okay, we're going to go ahead and get started. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month. Just a few quick reminders. Today's session is being recorded and will be available on the St. Clair County Community Mental Health YouTube channel. Please use the chat box for any questions or comments. Our presenter will address them as time allows. If you're requesting continuing education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed to you. And we are honored today to be joined by St. Clair County Community Mental Health's Medical Director, Dr. Brandon Moore. Welcome, Dr. Moore.
Good morning, everyone. Looks like we have a great turnout. It looks like we have over 100 people. And so thank you for joining. This is a kind of a continuation. I did a lecture last year called Amyl and the Sniffers, focused primarily on amyl nitrites, which we'll talk a little bit about again today. And we got a good feedback from that session, and a lot of people asked for a deeper dive into the subject. So I've included some of the information for those that maybe didn't see that presentation, but also we'll go into some more detail today. So hopefully everyone finds this helpful. Feel free to put those questions in the chat, and we'll address those as we go along, as we're able to. Again, thank you for joining. So inhalants, a deeper dive. So inhalants have been around for some time, mid-19th century, as far as the nitrates, such as amyl and other nitrates go. Glues and using those as inhalants became popular around the 1960s. And then aerosols and other gases, more 1970s and into modern day. So common ages, most common tends to be teens and preteens, that 12 to 17 age group. But there were reports as young as age 5 of abuse. And then we also know that some abuse continues on in adulthood. Many stop after their teen years, but there are cases where it continues on into adulthood. So the most recent survey I was able to find and update was 2023, and that showed less than 1% of those 12 and older had used inhalants in the past year. That study actually was encouraging in that that number had significantly decreased from other studies that I had seen in the past, particularly for that age. So that was encouraging, but overall prevalence, you can see 18 to 25, approximately 13, but that varies depending on study. Some show lifetime prevalence as high as 20% of individuals. Highest rates seen among white, Hispanic, and Native Americans versus Black that tend to have some of the lowest rates of inhalant abuse. And historically, males were higher than female, although, again, more recent studies have shown that that has actually balanced out, and that there is very little difference anymore between male and female ratio in inhalant abuse. Higher prevalence tends to be lower socioeconomic backgrounds, those youth that have a history of incarceration, poor family support, mental health issues, other issues of trauma and abuse, which also makes, if we're talking from a recovery standpoint, which obviously we are today in a recovery summit, A lot of those patients and backgrounds are difficult to reach, in that they have, limited access to resources. So these can be difficult to identify, and difficult to reach from a recovery standpoint. Slang terms that you'll hear, and this covers multiple types of inhalant abuse. Whippets is still popular, duster, some of the more common modern slang, galaxy gas, and I'll talk a little bit more about that. Poor man's pot, rush, chroming. Chroming, that is very specific to paint inhalation, um, particularly the silvers, chrome, gold paints. Um, those they tend to be higher in the volatile chemicals, in order to get those colors, and thus are more sought after as far as abuse, because they have higher contents of those volatile chemicals that they're looking for to get the high. So types of inhalants, aerosols. So, common ones: paint, air fresheners, even oven cleaner. Gases, that's where you get your computer dusters, butane. Um, Nitrous oxide tends to be a very popular one these days, but also propane. Some of us that are a little older still remember Freon, and that is still available, but very expensive. So likely not very abused these days. And then solvents, which are easy to obtain, things like glues, marker, gasoline, fuel treatments, nail polish remover. So if you wonder, like I do, why you're being carded when you're checking out at Walmart or Meijer, when you're getting things like fuel treatment such as intake cleaner, that's why they have an abuse potential and unfortunately are used for that purpose. And then you have the nitrites. Those can come with different labelings. They're sold as room deodorizers, leather cleaners, video head cleaner. Again, for those of us that still remember VHS tapes, they were sold as cleaners, to clean your VCR. So they can be abused in different manners. Snorting, direct inhalation, dusting, which is, um, again, inhalation directly into the nose, versus things like ballooning, where they fill a bag and then inhale, um, or even bagging, filling like a paper bag. Glading tends to refer specifically to the air fresheners. So this is a small nitrous oxide, and this would be ballooning. They crack that cartridge, fill up the balloon, and then inhale through that. This is actually a Brandon whipped cream dispenser, or I should say whipped cream charger for a whipped cream dispenser. Um, Again, this is a specific brand, Galaxy Gas. And that term has kind of been used more colloquially in the term to cover all of the nitrous oxide these days. But you can see there's different flavors. There's blueberry, strawberry. This one looks like watermelon, lemon. And these are large containers. Why somebody would need such a large container, I don't know. And this image actually was lifted from, um, shall I say, a common online retailer. We won't name any names, but it proves to us how readily available these are. And technically, they're sold for, restaurant use and things like that. Although you can see they're extremely colorful labels. Again, if they're being used in that manner, why are they being marketed in colorful labels in different flavors? And I think you can draw your own conclusions on that. Um, and in researching this, in updating this topic, Galaxy Gas brand actually pulled these from the market for a time, saying that they did not support, obviously, the abuse of their product. But again, they're right back out there. They're available to buy, online quite readily, which is unfortunate. So what effects do people get? So inhalants are rapidly absorbed and reach the brain in a matter of seconds. So it's hitting that reward pathway of the brain extremely fast. And that's because they're lipophilic, meaning fat loving. So things that are fat loving cross the blood-brain barrier very, very fast. Typically, our brain has, a fat layer that's not as permeable as things that are water soluble. But things like heroin inhalants are very lipophilic. They penetrate that fat layer in a rapid manner. So they cause euphoria, excitatory high, similar to other intoxicants. They also release dopamine, again, going back to that reward pathway in the brain. Uh, Typically only last a few minutes, which again leads to that repeated use and abuse because they need more in a quick manner to continue the high. And then nitrates specifically act in a different manner. They have more physical effects. Harmful effects, they can cause death via heart arrhythmia or suffocation. So direct and indirect. Direct suffocation, meaning you're inhaling so much gas that you can almost instantly suffocate because you're inhaling just the gas and not oxygen. And then indirect is more at a cellular level, in that some of these gases and nitrates bind with your cells and don't allow them to transport oxygen to your system, thus causing an indirect suffocation. Also can cause coma, hearing loss, changes in mood, obviously a concern for us here in mental health, rapid episodes of violence, confusion, hallucinations, apathy, which we see more in depressed state. So this can be kind of a mixed picture, almost like a mixed bipolar, in that they can appear apathetic yet, excitatory. Eventually causing nerve damage, numbness, weakness, tingling, even tremors, loss of bowel and bladder, and then liver and bone marrow damage. So what to look for in those abusing? Easy things, odor, staining of the clothes or around the skin. Again, back to that term chroming and the metallic paints. Sometimes those will leave us a noticeable stain on the skin. More subtle things, loss of appetite, watery eyes, um, and addict behavior, hiding their use, hiding the rags that they use, or the containers themselves, such as those gas containers that I imaged earlier. And then often rash or blisters to the hands and face. And I believe I have, yeah, some images of that. Um, I should have put a warning. Some of these images are a little severe. This is somebody that used duster or computer duster. You can see necrotic tissue there on the thumb. and also a burn here on the forearm. Having done ER work previously myself, the hands are a very easy clue to look for, and it's something I used to look for and taught other physicians, nurses, my residents to look for, um, because it can be quite a window into multiple abuse, actually. Um, right now, inhalants, these are actually a cold burn, so you'll see kind of these yellow blisters. Um, and I suspect the forearm burn actually is because of a large container. Um, Nitrous oxide, when you open it up, the container becomes quite cold. So you get cold burning versus crack cocaine use, where it is holding a pipe, and a heat burn, which is much more red and blistered. And that typically is confined just to the fingertips. You won't see the other burning like in this case. This is a much more severe case. Um, Hopefully you can see around my image. There's erosions to the tongue, and then you can see quite an extensive rash to his chest, shoulder, and down his arm. Um, there is some, bullous blisters, but then also this kind of extensive erythematous rash. Um, and again, this is due to duster or computer and spray abuse. But you would see similar things with other inhalant abuse. And here we have a brain scan. Uh, Image on the left is a normal brain. Image on the right is from chronic. This is particularly toluene, which is a specific inhalant, but you see similar effects in others. The outer white is the skull. Um, and these are spaces with spinal fluid. You can see it's more cloudy here. This is empty space. I suspect that is actual loss of spinal fluid, but more importantly, the shrinkage. You can see where there's significant loss of brain matter here on the left-hand side. Well, actually, it'd be the right. Images are reversed. And then these black marks here are shrinking of what we call sulci. So the brain has all of those fissures that come in on themselves. It should be nice and tight, like the image on the left. And this is actually opened up where you can see just what's dead space. Um, so this actually represents a loss of both gray and white matter in the brain, which is significant because those cause different concerns. Gray matter, you're going to see more loss in memory, confusion. White matter, you're going to see more loss of executive functioning, so decision making, and even loss of language skills, falls, things like that. So this is pretty impactful. I mean, I would equate this to the brain of a quite elderly person, what you would see as far as shrinkage. So detection. Unfortunately, inhalants by their nature are extremely difficult to detect. Um, they're volatile chemicals, obviously. So I spoke to a couple of the labs that we use locally, and even our more specific send out labs. And they said essentially they won't run them and won't test them because they're so volatile. Um, Anytime you have a substance, the machine has to be calibrated on that substance. And a lot of them use gas chromatography. Um, you know, put in simple terms, they can't run gasoline and other, solvents through their machine. Um, there would be risk of them, igniting or ruining their machines. So it's very hard to, come up with a baseline. Um, I did come up with a couple of studies where they were using urine versus blood as a source. Um, and they were finding some markers for abuse. However, even that poses a difficulty in that they're not studied enough to understand what the detection windows are. In other words, how far out from abuse, you know, other things like cocaine, heroin, THC, we have very specific known detection windows. You can detect within 3 days or 7 days, or a month, sometimes when you're talking about THC. Um, when you're discussing inhalants, there aren't those specific detection windows. And there also aren't respected cutoffs for when you can say this is abuse of inhalant or not. Um, further complicating matters, um, there's lots of false positives. Some of these things break down into what are normal metabolites, meaning our body already makes those things by breaking down, food and other things in our body, and also preservatives in food can also mimic some of these substances, causing false positives. So detection is, from a testing standpoint, is virtually impossible. So moving on to amyl nitrite specifically, I'll pause there. Christy, do we have any questions in the chat that I can answer up till now?
There are no questions yet.
Okay. Again, if anybody has any questions, please put those out there. I'd be happy to discuss further or answer anything.
Just one just popped up. Sorry to interrupt.
No, go ahead.
Can deficiency in B12 levels be a marker of correlation for use or abuse of inhalants?
No. In all the research I did, there was no specific vitamin deficiencies in B12 or others that would be suggestive of that. Good question, though. And I myself am always looking for new ways to kind of figure this out. But unfortunately, there's just not a lot of detection other than some of the visual signs, like I pointed out. Um, and I know I covered last time just asking. I've included this as my standard practice to include inhalant use when I'm asking about substance abuse, just as I would for cigarette, well, I've started to say nicotine because a lot of people have switched over to vape. So I just say nicotine now instead of cigarettes. But I've included inhalants in that. I'll just go down the list. Nicotine, alcohol, THC, cocaine, heroin, methamphetamine, inhalants, or hallucinogens. And I'll just go through that. I find that prompts people a lot more, especially versus just leaving it out of the discussion. So let's talk about amyl nitrite specifically. So they are inhaled. There's different classes, amyl, butyl, isobutyl, isopropyl. They're a vasodilator. They are a depressant versus more the excitatory of the other inhalants we're discussing. First documented in 1844, but first medical use documented approximately 20 years later, and initially synthesized by a French chemist. So what do these look like? These are sold in, again, these colorful little vials, which, going back to our discussion of why they're used, such as video head cleaner. Um, these look like more than that to me. But again, I'll let everybody make their own judgment on that. Um, they're a highly volatile oil, typically clear or yellow. Um, they can have different smells, anywhere from fruity to more of a dirty sock smell. Street name, most common, poppers. I've heard the others, Roche Purple Haze, Liquid Gold. Um, Poppers they got from kind of their initial, and I wish I would have included a picture of that, how they used to come, which was a glass ampule, where you actually had to crack the soft glass ampule, and it made a popping sound. So they've kind of always held that name over the years of poppers. So they only have two clinical uses, angina and then cyanide poisoning. Um, and even in cyanide poisoning, they've been kind of replaced by more modern uses. But essentially, there used to be amyl nitrite kits, for cyanide poisoning. And again, you'd crack that ampule, have the patient um, inhale that, and because cyanide is a very tight binder, to the cells, and particularly in relation to oxygen, and it doesn't allow the oxygen to bind to your cells. Um, Amyl nitrate essentially fools the cells and gets them to release the cyanide, so that that can be dissipated. Um, and it does cause another condition, but essentially allows the oxygen to then be to begin transporting in your cells while kicking off the cyanide. So that's how they actually had a legitimate clinical usage. But again, that's been replaced nowadays by more modern methods. These days, they're used more as a party drug in recreational uses, um, primarily to enhance sexual experience, and enhance pleasure. Uh, Historically, and still common, amongst men who have sex with men. So, how easy are they to obtain? Unfortunately, still rather easy. Um, Again, because they have medical usage and, yeah, I guess somewhat legitimate uses in cleaners and things, they are a legal substance. However, it is still illegal to misuse as a recreational drug. Typically, you see them sold in adult stores, or even under the counter, um, gas stations and others. So, although the other inhalants can cause, more addiction, the amyl nitrates don't, cause addiction from or withdrawal from a traditional standpoint. Like there can be a tolerance built up to them. And again, different ways of use. Most commonly, I would say, is the sniffing, directly from those small bottles. But you can, see other uses, soaking a cloth, and even dipping cigarettes and other things, which is again not advisable, as they are an oil and extremely flammable. Um, so there's cases of, significant burns and things because of that use. So again, that high occurs within seconds, only last a few minutes. Again, leading to repeated use. Um, and you can see why it's used, in the manner it is. It lowers inhibitions, impairs judgment. Um, Side effects: fast pulse, flushing, headaches, restlessness, even sensitivity to light and blind spots in your vision. More serious risk, just like the other inhalants we discussed, can cause brain damage over time, leads to easier transmission of sexually transmitted diseases. There can be something called sudden sniffing death syndrome, where the heart suddenly stops immediately due to the use. Methemoglobinemia, um, again, inadequate transport of oxygen. Going back to that treatment of cyanide poisoning, this actually is the condition you're inducing when you're giving somebody nitrites in cyanide poisoning. But even in this condition, it transports oxygen better than when you have cyanide poisoning. But this is still not good. Your blood is still not transporting oxygen in a proper manner. And then you have the vision changes again. That's more specifically the isopropyl nitrite, which is not as common. Conditions, this is kind of more general, not just nitrates, but conditions to be concerned about. If somebody's using inhalants, obviously pregnancy, if they have pre-existing heart conditions, particularly hypertension, and if they already have increased intracranial pressure. So certain conditions that congenitively that have that, or somebody with a history of aneurysm. I would include stroke with that also, would be at increased risk of other effects if they were to use inhalants. Again, signs, and this goes back to nitrites, because it's an oil, direct skin contact, you can see rash, burns, blisters. Drug interactions, these interact with medications for erectile dysfunction, leading to rapid drops in blood pressure, which can cause stroke, myocardial infarction or heart attack, and even death. And then combined with stimulants, can increase heart rate and also cause cardiac arrest or death. So how do we treat inhalant use? Essentially the same way we would treat any other substance use disorder. Cognitive behavioral therapy, counseling, substance use support groups, 12-step programs, family counseling, and use of motivational interviewing. I will add, whoops. I think most all of which we offer right here at St. Clair CMH. And then there is, the national helplines, obviously 988, Community Mental Health here, and then the SAMHSA national hotline. And also NA, not just AA, but Narcotics Anonymous as well. And with that, I will open it up for discussion and questions.
All right. So Carolyn had put in a comment. Are these substances more addictive than others? Looking at those pictures, you would think one would stop at this level and they have so much deterioration. I think they were talking about the earlier, or she's talking about the earlier ones of the brain, the pictures of the brain.
So yeah, a couple points there. The brain is chronic use. So I would say that's probably years of use, leading to that much brain damage. But still, a significant, point to make, that it can cause that much damage. So that would be years of use. The blistering, that can occur pretty quickly. I would say the image I chose, and I chose it obviously because it was, showed the extreme. I've never seen one that bad, but I've seen stuff pretty close to it in the ER, as far as blistering, on the hands, fingers, and even on around the mouth. Um, and to your point, Carolyn, you would think that yes, that would be a deterrent. Unfortunately, um, when they're that far into their use, it really doesn't seem to be. Um, and these are highly addictive, and I would classify them as being more addictive, than other substances. Um, and that goes back to a couple of points I made. Um, the rapid absorption. Um, these are probably the most rapidly absorbed substance of abuse, um, over and above nicotine, heroin, cocaine, even, um, which cause, some of those, particularly cocaine, cause a pretty rapid high. Um, these inhalants cross that blood-brain barrier that much faster. Um, and anytime you hit that reward pathway in the brain that quickly, the more addictive something is. And then the fact that the high doesn't last. This isn't, an hours long high, like many of the other substances I just mentioned. This is a matter of minutes. Thus, they want to continue their high, so they use again. And that just supports that rapid addiction. And the fact that I say, yes, I believe they're more addictive than other compounds. So thank you for that question. That's a very good question.
Right. We also had a comment from Amanda, and she said, we had a probationer that was hospitalized due to B12 deficiency and had to get the B12 shots. He was hallucinating and it was from inhalant abuse.
So there absolutely can be, hallucinations, particularly again when they're well into their abuse. Um, I probably didn't stress that earlier, but there absolutely can be hallucinations. Um, and in reading the case, the image I had of, the hand and arm, that individual presented to an ER with hallucinations. So that is not at all uncommon. Um, I haven't seen the reference to B12. I would want to look into that more. Um, I can't, I can't say from my research whether that's coincidental, whether he already had a natural B12 deficiency, whether this caused that, or perhaps, I guess another thought I have is whether, if he already had a B12 deficiency, perhaps it made the symptoms worse. But I would, again, I would want to look into that more. I haven't seen much as far as, specific vitamin deficiencies, but, uh, an interesting point that, for further research down the road.
And the next question from Christy is the damage of the brain from inhalants permanent? And how quickly does the type of damage we saw in the scans happen?
Um, there's no defined period. I believe that image, defined at least a year or more of chronic use. So it is chronic use that causes that. Um, and unfortunately, no. The brain is not an organ that repairs itself, like the liver and other things. That damage, unfortunately, would be permanent. That tissue is not going to, um, regenerate, regrow. Um, some of those neural connections are gone permanently.
Okay. And from Preston, it says, in your opinion, what is the best way to deter people from obtaining nitrous. We have had cases where people are getting them mailed to their house, which negates having someone on a GPS tether to stay away from normal places that sell them.
Preston, that's an excellent question. I myself was extremely surprised in how readily available these are online. And again, I don't want to lead anybody to them, but let's just say, very common online retailers, and you could probably have them at your house very rapidly. And that's unfortunate and makes it extremely difficult to deter use. Um, the things I would say is um, trying to put some kind of barrier there, um, the same we would for any other use. Having those around them watch for it, trying to intercept or block deliveries, um, taking away financial means, if possible, to obtain the substances, putting blocks or restrictions on credit and debit cards, um, particularly for teens, trying to restrict, access to certain websites or ordering. Um, those are some of the things I can think of. Um, but Preston, you're absolutely right. It's an extremely difficult problem to solve because they're so readily available. You can sit at your computer and order them. You don't have to go to and they're just as easily obtained in the community too. These nitrous rigs are available at pretty much any smoke shop in town, probably.
And a question from Lynn, is there brain damage no matter what, even if it's minor use or only excessive use? With recovery and years of sobriety, can the brain heal itself?
Um, so again, the brain will never truly heal itself in that tissue won't come back. Um, can you develop some new neural connections? Yes, with the tissue that's there. Um, so, continued cognitive behavioral therapy, if they do have, physical dysfunction as far as nerve damage and things, um, some of that can probably come back with physical and occupational therapy. Again, just generating new neural connections. Um, but that tissue will never come back. Now, to your point in the question, yes, that is from chronic use. Uh, you're not going to see that in somebody that's, only done this a handful of times. You're not going to get, significant brain damage in that case.
Okay. And Sharon asks, does the use of these inhalants create lesions on the brain, which can create psychosis or schizophrenic-like symptoms?
Yes, and not specific lesions, but the areas of brain that it affects and the damage it causes there can absolutely present a mixed picture of symptoms, um, depression, you know, aggression, violence, agitation that we would sometimes see in schizophrenia or schizoaffective, and up to and including, visual and auditory hallucinations, um, which can give you know, a psychosis picture that you would see in schizophrenia, schizoaffective disorder, or, depression with psychosis or bipolar with psychosis. Um, so absolutely, they can mimic a lot of our mental health disorders, which is troubling because you know the inhalant abuse can easily be missed because of that. And, somebody presents to the ER and maybe even is admitted to the mental health unit, um, and it's just attributed to a mental health disorder, particularly if they have any pre-existing mental health. um, I think it's even easier to attribute it to their mental health, and ignore that there may also be abuse going on. And that's why I stress, always including it in questioning, whether this is the first time you've encountered a patient or not. Um, always going through those substance questions and fishing out whether there's other causes for their symptoms. I think that's a significant point to stress, that we not ignore that this may be a cause. It's, you know, there's a high level of use in the community. And in this community in particular, I know. So I think it's important to screen for that and not just chalk it up to, well, this is their mental health.
And we have a question from Andrew. Is there any push in Lansing that you are aware of to make it more difficult to obtain these legal products? It would seem to me that it should be at least as difficult to obtain as Sudafed.
You would think, and my hope is that someday we move towards that and that they aren't as readily available as they are currently. I have seen different pushes over time. I'm not aware of any current legislature in Lansing to do with this. There have been pushes over time. What makes it difficult is, particularly the nitrous oxide. Like a lot of things, there's legitimate uses to that, but to your point, there's legitimate uses to a lot of the things that were, Sudafed and others that were carded for. And I mean, from my standpoint as a practitioner, absolutely, I think we should move towards that. And I would support legislation, to that effect.
And Bailey asked, what are the first warning signs with fine or gross motor skills deteriorating to suggest nitrous use?
Um, I would say the initial signs are quite subtle. So it's hard to pick up initially. I think the loss in appetite is one. The motor signs you're going to see much later. So it's more the subtle signs, the loss in appetite, the nausea, vomiting, and then behavior that you would see in other substance use. Um, obtaining money to obtain the substance of choice, going out of their way to, stop at or shop at places that sell these substances. Um, the this drug seeking behavior that you would see in other substance use. I would say those are some of the early signs.
That is all the questions in the chat at the moment. Oh,
Well, we can give it a couple of minutes. Again, great turnout. Great questions, everyone. I appreciate the questions, and would love any feedback anybody has for future sessions or topics that, sorry, it's a slideshow. Any future topics that you'd like to hear presented at Recovery Summit next year, or any of our other community presentations, or within our own organization. And certainly open to those ideas.
I was just watching the chat to see if we got any more questions. There are some comments coming through about excellent information and thank you. Someone just asked, Savannah did, can Can you discuss more about the sudden sniffing death syndrome? I have worked with people who have had family members suffer from this and just wanted, sorry, wanted more information on it.
Um, Simply, it can, in some individuals, and it's not really knowing the mechanism or who would, in particular would be at risk. Obviously, if you have some of those pre-existing conditions we talked about of already having, heart arrhythmias and things, but unfortunately, yes, this can occur on first use of an inhalant. Um, and it's um, just a sudden stopping of the heart. That's not even that direct or indirect suffocation that I mentioned. Um, it can just in simple disrupt the electrical conduction of the heart enough that it suddenly stops beating, which is obviously very concerning in that you don't know, you know, who or when that would happen. So that's hard to predict.
All right. I was just looking over the chat one more time just to make sure we didn't miss anything. And there's one just popped up. Is it possible for someone to abuse household items such as Febreze to achieve the same effect?
Absolutely. Yeah, this doesn't have to be specialized items. A lot of these things are found, in everybody's home. Whether it be, whatever your choice of hair freshener is, Glade or otherwise. But aerosol deodorants can be used. It, Essentially any of those aerosolized compounds or other things with volatile chemicals, paints that you may have, spray paint, gasoline, other things that you would find in the garage. So yeah, unfortunately, a lot of this is, pretty easily accessible and I think probably in every one of our households.
Right. I'm not seeing any other questions. Just a lot of thank yous and appreciate the information. And I want to also thank you, Dr. Moore, for your time and information. It was um, very eye-opening. So thank you.
You're welcome.
Also, I just want to thank all of you for joining us for today's session and for being part of this year's Recovery Summit. Throughout the month, we've had the opportunity to come together as a community, learn from experts, hear powerful stories of recovery, and gain tools and strategies to better support those we serve. We are truly grateful for your participation, engagement, and commitment to advancing recovery in our communities. Your presence helps make this event meaningful and impactful each year. A short survey will be emailed to you following today's presentation. We would greatly appreciate your feedback to help continue improving future recovery summits. Certificates for professional credits will be distributed in the coming weeks. On behalf of St. Clair County Community Mental Health, thank you again for joining us and for the important work you do every day. We look forward to connecting with you again at next year's Recovery Summit. Thank you.
Thank you all.